Because the next problem is women with sleep apnea are less prone to getting high blood pressure. Okay. Um, so this again is predominantly a men problem. So the stop bang with blood pressure gives another advantage to men. So, like I said, when you go through this list, um, this is a big problem. And again, many women develop obstructive sleep apnea or sleep disorder breathing around menopause. That's before 50. Um, but we use over 50 as a predictor. So what that means is younger women, and there are women that either for medical or even sometimes, if they've had surgical procedures, often the case of gynecological cancers, for example, that have surgically induced menopause to address those cancers. The age of 50 is just, again, to anyone that's got any, ounce of common sense, an absolute ridiculous line in the sand when it comes to women. Uh, so, it's really not accounting for these hormonal changes and risk factors for the same. If the question said, are you over 50 male? And then otherwise, have you gone through or are you going through menopause? And you've got a point for that. Well, that would bring some equivalence to it all. So, like I said, five or more is considered high risk. You will easily score that as a man versus a woman. And this will then lead to, like I said, women not making the grade, which means that the testing that would have been appropriate gets delayed, which means the diagnosis is delayed, which means the consequences of the disease run rampant for longer than they should have.